Hello and welcome. Let's talk about ecbolics and tocolytics. So, what are ecbolics? Ecbolics are the drugs which stimulate uterine contraction. These includes ergometrin, oxytocin, and prostaglandins. Now, ergometrin. Only ergot alkaloid is used for stimulating uterine activity. It has main effect on uterine muscle and causes sustained tonic contraction of all parts of the uterus at a time and does not cause physiological contraction, and the uterus can be stimulated all the time but more sensitive at late pregnancy. Alpha and dopamine receptor agonist. It acts most immediately when given intravenously. Indications: prevention and treatment of the postpartum hemorrhage. Contraindications includes induction of the liver, ischemic heart disease, and peripheral vascular disease. Adverse effects include fetal death, rupture of the uterus, hypertension, and postpartum headache. Now, drugs used for induction of the liver includes oxytocin and prostaglandins for multipara. These drugs can cause physiological contraction, where it's contraction of the fundus and body of the uterus followed by relaxation. Now, oxytocin. It is released from the posterior pituitary hormone, and the mechanism of action now embraced the milk ejection in the lactating mother by contraction of the myoepithelial cells surrounding mammary alveoli. In uterus, there is rhythmic contraction with full relaxation and mimics physiological contraction. Clinical uses: induction of the liver is the primary use. Postpartum hemorrhage can be given with ergometrin in case of incomplete abortion, in case of uterine inertia. Adverse effects include rupture of the uterus, no liver progression due to chronic contraction, convulsion due to water intoxication, maternal hypertension, fetal asphyxia, and neonatal jaundice due to increased erythrocyte fragility causing hemolysis. Now, contraindications: grand multipara, cephalopelvic disproportion, maternal hypertension, cesarean section, fetal distress, meconium stent liquor, and placenta previa. Now, prostaglandins, dinoprost and dinoprostone. These are used to induce liver, missed or partial abortion to terminate pregnancy, termination of treatment of hydatiform mole. Now, gimiprost, given per vaginally to soften the cervix. Carbaprost, used for postpartum hemorrhage due to its oxytocic action, highly effective and can cause hypertension, asthma, and pulmonary edema. Now, tocolytics. So, what does it mean by tocolytics? Tocolytics are the drugs which relax the uterus. The aim includes prevention of the premature birth and threatened abortion. The drugs are beta-2 agonist, magnesium sulfate, prostaglandin synthesis inhibitors, and calcium channel blockers. End of the topic.